June is Pride, a time for solidarity and celebration of the LGBTQ+ community and to embrace identity.
Support and acceptance has a tremendous impact on someone's mental health and even personal safety.
There are so many resources here locally for LGBTQ mental health. Morning anchor and health reporter Kirsten O'Connor is here now to ask a doctor about it.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Dr. Sherry Benton is a psychologist, and she's actually the founder of TAO Connect, which stands for Therapy Assistance Online. We've done stories on therapy assistance online here on clickorlando.com. She also says her online mental health tools are for self-help or to be used with a therapist or peer counselor. And she says it's important to provide mental health resources that focus on diversity and give teens and young adults in the LGBTQ+ community a place to feel acceptance.
The needs, especially for adolescent and young adults, LGBTQ plus, are great. About 60% of adolescent and young adults report anxiety symptoms, and about 40% have been suicidal or suffering symptoms of depression. And what TAO has is some evidence-based CBT-based treatments for anxiety and depression that can be really effective. And all of our materials are really attend to diversity, both in terms of racial, ethnic, religious, and LGBTQ versus straight.
Now, about 200 colleges and universities use the TAO Connect app, but Dr. Benton says LGBTQ individuals are 3 times more likely to experience a mental health condition.
I think the two things that really contribute to that kind of level of prevalence and the level of kind of suffering for people in that community are acceptance from others and self-acceptance. If you have those things, you're less at risk for things like anxiety and depression in the LGBTQ community. Unfortunately, for a lot of young people, those are problems. And when you're not feeling like you have a community of acceptance that supports you, your risk for anxiety and depression goes up. And especially for adolescents, young adults who are just coming to terms with their own identity, self-acceptance is an issue. Believing that this is okay, that this is a good and fine way to go about in the world, and you'll be okay. Well, that's a struggle, especially if the people around you are not particularly accepting. Then it becomes very difficult to accept yourself. And I really think that a lot of the prevalence in anxiety and depression really boils down to the issue of acceptance.
And she also says when seeking the right therapist for any LGBTQ mental health needs, there are a few things to consider.
Finding the right counselor is crucial for anybody. There's got to be a good match. There has to be a sense of trust and comfort and acceptance that's there. And if you're not feeling that, go find another counselor. And that's true no matter who you are. That we connect with some people more than others. That's just the way it is. And finding that person you can kind of connect with is critical for it to be effective, because you've got to feel comfortable sharing anything and feeling like that's going to be okay and it's going to be safe and you're going to find it helpful.
Now, Dr. Benton also says it's not important to know whether or not you're diagnosable. If you have mental health symptoms that are affecting your everyday life, get help, even if it's just minor, because you don't want to wait.